Hey everyone, so today we're going to explore two separate strategies to not just improve knee flexion range of motion, but to improve the capacity of the muscular tissues surrounding the knee joint to manage and distribute forces as the knee biases flexion. So the first strategy we're going to talk about is how we can bias the knee towards flexion and then indirectly perturb the knee. Well, the second strategy is going to directly perturb or directly challenge the knee. So it's very much about the overarching concept that guides the implementation of both these strategies. Okay, because one common feature that we see in clients experiencing knee pain is this tendency to quickly extend the knee when the lower limb is experiencing forces. And one of the reasons why we believe they extend the knee too quickly is because when we extend the knee, we move towards a place of less movement options. We move towards a place of less variability, where we have less relative motion between the femur and the tibia. So it reduces the challenge to the tissue surrounding the knee joint to manage forces. So it can be seen as a protective strategy. And while it can be a necessary protective strategy early on to avoid pain or avoid discomfort, we do want to work towards restoring the capacity to improve the low capacity of the tissues surrounding the knee. Okay. So again, the first strategy that we're going to cover is a strategy that indirectly perturbs the knee. Okay, and this involves biasing the knee towards flexion first and then challenging dynamically a neighboring joint region. Okay, because what we're trying to do is we're trying to destabilize that habit or that protective strategy of moving back into knee extension. Okay, and then we want to work towards directly challenging that capacity to maintain knee flexion as we experience load around the knee. So we're going to move to a strategy where we move from a flex position at the knee and then we extend the knee under load, but we're trying to prolong or delay that transition from flexion into extension of the knee. Okay, so again, trying to destabilize that protective strategy or that default pattern of extending too quickly. Okay, so it's very much about the, like I said, the overarching concept that guides the implementation of these loading strategies. So the first strategy here, as you can see, is this bent knee calf raise in the medicine ball with the pelvis proximally bridged. Okay, so we're engaging the forefoot with the medicine ball. We're pre-positioning the knee towards flexion at the beginning, and then we're driving down through the forefoot and bridging the pelvis proximally off the ground or off the table. We're maintaining that position as we lower the heel and raise the heel, so as we dorsiflex and plantar flex the ankle. So we're getting load through the foot and ankle, through the plantar flexors, through the knee, and through the hip. Okay, but the key thing here is, again, we're trying to give the knee no option but to stay biased towards flexion as we get some load distally through the foot and ankle, but also through the knee and hip as well. But we're doing so in a manner that doesn't distribute too much force through the knee at the beginning, and that's why we see this as more of an indirect challenge or an indirect perturbation to the knee. But we're still improving the capacity of the lower limb as a whole to manage forces as we bias the knee towards flexion. And then we can move towards strategies where we're more directly challenging or directly perturbing the knee joint. Okay, so moving into the next strategy here, and while this doesn't necessarily represent the next progression, it represents a shift in the thought process away from just indirectly challenging or perturbing the knee joint towards directly challenging or perturbing the knee joint. Okay, because we're working towards extending the knee under load from a greater levels of flexion and then trying to slow down that transition or prolong that transition from knee flexion to knee extension under load. Okay. So we have the heel hovered off the plate here to challenge the isometric behavior of the plantar flexors here. So again, you could see that as an indirect perturbation as well. But the key thing here is that we're driving force through the forefoot and directing that force of the body up and forward towards the wall. And directing that force up and slightly forward towards the wall allows us to maintain that force through the forefoot, but also allows us to maintain that positive shin angle, which allows us to maintain the knee biased towards flexion for a longer period of time. Okay, because again, we're trying to delay or reduce that tendency to snap the knee back into extension. Okay, so you can almost view this progression here, this overarching progression, as the goal of trying to hold on to as much variability between the femur and the tibia, or within the knee joint, for as long as we can, as we expose the knee to more force. okay, or to forces in general, okay? Because generally what we see in clients is this tendency to move the knee towards a place of less movement options or less variability. So we're trying to hold on to more variability, more movement options for as long as we can, as we expose the knee to greater and greater levels of force, okay, to improve the load capacity of the muscular tissues around the knee joint, okay? So again, I know we've explored two separate strategies for the knee joint here, but it's much more about the overarching concept that guides the implementation of these strategies that we really want you to understand.